All right, so we're going over current medical diagnosis and treatment, 2025. All right, so disease prevention and health promotion. One, general approach to the patient. The medical interview serves several functions. It is used to collect information to assist in diagnosis, the history of the present illness, to understand patient values and goals, to assess and communicate prognosis, to establish a therapeutic relationship, and to reach agreement with the patient about further diagnostic procedures and therapeutic options. It also serves as an opportunity to influence patient behavior, such as in motivational discussions about smoking cessation or medication adherence. Interviewing techniques that promote shared discussion, making increased patient involvement and satisfaction. Effective clinician patient communication and increased patient involvement can improve health outcomes. Patient adherence. For many illnesses, successful prevention and treatment depend on difficult fundamental behavioral changes, including altering diet, taking up exercise, giving up smoking, cutting down drinking, wearing masks to prevent infection, adhering to complex medications, regimens. Adherence is a common problem. Up to 50% of patients fail to achieve full adherence, and one third never take their medicines. Many patients with medical problems, even those with access to care, do not seek appropriate care or may drop out of care prematurely. Adherence rates for short-term self-administered therapies are higher than for long-term therapies and are inversely correlated with the number of interventions, the complexity and cost, and the patient's perception of over-medication. As an example, in the persons with HIV, adherence to antiretroviral therapy is a crucial determinant of treatment success. Studies have unequivocally demonstrated a close relationship between patient adherence and plasma HIV RNA levels, CD4 cell amount counts, and mortality. High adherence levels are needed to maintain virologic suppression. However, studies show that adherence varies over time, and inconsistent adherence is associated with incomplete viral suppression. Patient reasons for suboptimal adherence include simple forgetfulness, being away from home, being busy, and changing daily routine. Other reasons include psychiatric disorders, depression, or substance misuse. Uncertainty about the effectiveness of treatment, lack of knowledge about the consequences of poor adherence, regimen complexity, and treatment side effects. The rising costs of medications include generic medications, and the increase in patient cost sharing burden have made adherence even more difficult, particularly for patients with lower incomes. Patients seem better able to take prescribed medications than to adhere to recommendations to change their diet, exercise habits, or alcohol intake, or to perform various self care activities such as monitoring blood glucose levels at home. For short term regimens, adherence to medications can be improved by giving clear instructions, writing out advice to patients, including changes in medication, may be helpful. Because low functional health literacy is common, almost half of English speaking US patients are unable to read and understand standard health education materials. Other forms of communication, such as illustrated simple text, videotapes, or oral instructions, may be more effective. Clinicians and healthcare delivery systems should provide culturally and linguistically appropriate healthcare services to help improve adherence to long-term regimens. Clinicians can work with patients to reach agreement on the goals for therapy, provide clear, concise information about the regimen, ensure understanding by using the teach back method, counsel about the importance of adherence and how to organize medication taking, reinforce self-monitoring, provide more convenient care, prescribe a simple dosage regimen for all medications, preferably no more than 1 or 2 doses daily. Suggest ways to help in remembering to take doses, time of day, mealtime alarms, and to keep appointments. Prescribe lower cost generic medications when available and provide ways to simplify dosing. Medication boxes. Single unit doses supplied in foil wrappers can increase adherence but should be avoided for patients who have difficulty opening them. Medication medication boxes with compartments, medisets that are filled weekly are useful. Devices can provide feedback to show patients whether they have taken doses as scheduled or to notify patients or others within the day if doses are skipped. Reminders, including cell phone text messages, are another effective means of encouraging adherence. The clinician could also enlist social support from family and friends, recruit an adherence monitor, provide a more convenient care environment with fewer barriers, and provide rewards and recognition for the patient's effort to follow the regimen. Collaborative programs in which pharmacists help ensure adherence are also effective. Motivational intervening techniques can be helpful when patients are ambivalent, ambivalent about their therapy. Adherence is also improved when a trusting clinician-patient relationship has been established and when patients actively participate in their care. Clinicians can improve patient adherence by inquiring about specific and behaviors and barriers in a non-judgmental manner. When asked, many patients admit to incomplete adherence with medication regimens, plans for giving up cigarette smoking, or engaging only in safer sex practices. Although difficult, sufficient time may be made available for communication of health messages. Medication adherence can be assessed generally with a single question. In the past month, how often did you take your medications as your clinician prescribed? Other ways of assessing medication adherence include pill counts and refill records, monitoring serum, urine, or saliva levels of medications or metabolites, watching for appointment non-attendance and treatment non-response, and assessing predictable medication effects such as weight changes with diuretics or bradycardia from beta blockers. In some conditions, even partial adherence, as with medication treatment of hypertension and diabetes mellitus, improves outcomes compared with non-adherence. In other cases, such as HIV antiretroviral therapy or tuberculosis treatment, partial adherence actually may be worse than complete non-adherence. All right, guiding principles of care. Ethical practices are called in medical care at both the micro level of the individual patient clinician relationship and the macro level. In the macro level of allocation of resources or the adoption of infection reducing public health interventions. Ethical principles that guide the successful approach to diagnosis and treatment are honesty, beneficence, justice, avoidance of conflict of interest, and the pledge to do no harm. Increasingly, Western medicine involves partnership with patients in important decisions about medical care, which colorectal screening tests to obtain, or which modality of therapy for breast cancer, or how far to proceed with treatment for patients who have end stage illnesses. The clinician's role does not end with diagnosis and treatment. The importance of the empathic clinician in helping patients their families face serious illness and death cannot be overemphasized. To cure sometimes, to relieve often, and to comfort always is a French saying as apt today as it was 5 centuries ago. As is Francis Peabody's admonition. The secret of the care of the patient is in caring for the patient. Training to improve mindfulness and enhance patient-centered communication increases patient satisfaction and may also improve clinician satisfaction. Health maintenance and disease prevention. Wait.